Welcome back to STL Live. I'm Andy Ruzicka. My guest, the Public Health Program Supervisor, Michele Welker, is here to talk about all things flu season. So, when is flu season? Why is it a public health concern? And who is at a higher risk? All of that to reduce contracting it and how to treat the seasonal flu. Michele, thanks for coming on the show and taking time out and being with us today.
Thank you for having me.
So, we teased it right there. When is flu season?
Well, it varies a little bit year to year, but it is generally in the fall and winter. So, February, it's ramping up a little bit.
So why is it a public health concern?
Well, it's a public health concern because the flu is prevalent. The CDC basically says that about 8% of the population will get the flu annually. And so it's relatively easily spread. So we look at making sure that we're doing as many preventative measures as possible to prevent that spread.
So preventive measures, obviously very important. It's one of your biggest campaign. I think you even have it on a couple buses around St. Louis.
Yes, we do.
What can people do to prevent? What's the prevention methods people can do?
So the number one is, of course, getting vaccinations. So every year you would need a new flu vaccination. It's not too late. You can still get one this year. I know it's a little bit later in the season, but we still do recommend getting a flu shot. And then also the other big preventative measures are good hand hygiene, making sure that you're washing your hands appropriately, that you're covering coughs, that you're staying home when you're ill, and just try to prevent the spread.
So it is not too late. So I mean, the flu season lasts throughout almost the whole cold winter time, you'd say.
Yes. So, we're still going to be having cases of the flu into probably late winter. Early spring, so of course it's not too late.
Is it different any nationally versus St. Louis peak season, or is it relatively similar?
It varies a bit from year to year, but it is generally fall and winter that the cases really increase.
The annual trends are about the same year to year.
There's a little bit of variation, but yes.
Okay. So the actual cases though that you see may be different from the reported cases, is that correct?
Well, the reported cases, the numbers that we have are those cases that are laboratory confirmed. So those are the people who have sought out medical help and have gotten or have received laboratory results.
Gotcha.
So sometimes people are ill and they just stay home and recover at home, so we don't actually have that data.
So how can you reduce when you already have it? How can you reduce the amount of time that you're down sick, or is it kind of vary from person to person, their own bodily mechanisms, for each person?
It's going to vary from person to person, but of course we're going to recommend that you stay home. First of all, that's going to help prevent the spread of the illness, but then also make sure you're getting a lot of rest, taking in a lot of fluids, just like your grandma used to tell you, make sure you're getting your rest, and then avoid alcohol, avoid tobacco, and just.
So that is how you treat the flu. You stay home and you rest. That's basically all you can pretty much do at that point.
Well, it depends on, of course, your symptoms as well. If you're having some severe symptoms, if you already have maybe some additional underlying health conditions, we would want you to seek out, advice from your medical professional.
So that brings me to that question, when is the time if someone's at home and they say they know they have the flu, is there a point where they say to themselves, I need to see a doctor? Or is there a point you recommend that someone is at home and they have it, or if they can just power through it without having to see a medical professional?
It's always good to call your medical professional and ask for advice. Depending on the individual person, there could be some other viruses going on, or there could be some other underlying issues that could really make, the health risk much more complicated.
Gotcha. We'll talk more about that in just a moment. We're going to have to take a short break, so stay with us here at STL Live. We'll be back after this break with more from Michele Welker.